The views and opinions expressed during this program are those of the host, guests, and callers and are not necessarily those of this station, its management, or other employees, advertisers, or sponsors.
Good morning. It is Thursday, October 1st. I'm Michelle Dials, and you're listening to Talk of the Town on 1230 WSAL. Joining me this morning from Logansport Memorial Hospital, we have Carmen Danhauser with us. Good morning.
Good morning, Michelle. How are you?
I'm good. How are you?
Good.
And because it is October 1st, that means it's Breast Cancer Awareness Month.
Yes, ma'am. We are starting things off right at the very beginning of the month. We just couldn't wait, to get going on our efforts.
So every year we do a breast cancer awareness talk of the town. Mm-hmm. And every month or every year, the hospital honors some breast cancer survivors. So we have two people with us this morning. Do you want to introduce them?
Yes, I do. One of the best parts about my job is when I get to step outside of my scope of responsibilities a little bit and work with women like this. So we have two lovely ladies with us today, Dee Dee Tangy and Joyce Eshelman. They are two of my featured survivors, and you might have seen their pictures around town on a billboard and a newspaper as part of our mini campaign. I usually do feature three, and I did this year. We also have a third survivor, Jenny Sweet, who is not available to be with us today, but we do miss her, and she had a great story to share as well. So I'm so glad these ladies are here, and they're just going to share some great stories with you.
All right. Well, thank you, ladies. We'll look forward to hearing from you in a minute, but we'll also introduce Dr. Todd Weinstein, who is with us again this year. Good morning.
Good morning.
And I guess, Dr. Weinstein, we'll start with you and tell us a little bit about your background and why this is so important.
Well, I'm a general surgeon. I'm one of the three general surgeons here in Logansport. I'm one of the four surgeons who actually work with breast cancer patients here in Logansport. My partners, Mike Lalla and Gerhard Winkel, and then also Dr. Jim Hall over in Women's Health Center. So there's several different choices. I've been here in Logansport for 24 years now. Ever since I came out of residency at Indiana University, before that, the University of Florida Medical School, and it's I've now been in Logansport longer than I was ever anywhere else. So I'm pretty much a Logansportian at this point.
So what brought you to Logansport?
Well, actually, I got to Indiana University for my residency, and I married a young Hoosier lady. So that kind of determined that we were going to look for a spot in Indiana, and then quite honestly, once I started looking around, what drew me to Logansport was the town and the community, and then also there were a couple of surgeons here back then named Gary Miller and Fred Hillis, who were just very good guys, good surgeons, good to work with, and that's pretty much how I picked.
All right. I'd never heard that story, so yeah. I thought it might be interesting for people to know. Okay, so we hear a lot about breast cancer. Can you give us some statistics about the disease?
Yes. Breast cancer is the most commonly diagnosed non-skin cancer in the United States. There's about 235,000 women per year in the United States diagnosed with breast cancer. If you include a precancerous disease called ductal carcinoma in situ, it brings it up to almost 300,000 women diagnosed with breast cancer in the United States. Worldwide, it's about 1.3 million women yearly who get breast cancer. Breast cancer is also the second most common cause of cancer death in the United States, behind only lung cancer. So it's a very important disease. Now, the good news is that the death rates from breast cancer have been dropping every year since 1989. And so we are getting better at helping people with this disease, and we're getting better at beating this disease. Right now, there are almost 3 million breast cancer survivors in the United States. So I think that's really a great number to focus on.
You mentioned breast cancer in women, but men can also get breast cancer, right?
Men can get breast cancer. It's absolutely true. About 2,300 men per year. So it's only about 1% of the number of women. But men certainly can get breast cancer. Unfortunately, since men don't really think of this lump on their chest as being likely to be breast cancer, frequently in men it's diagnosed later, and so the success rate with men is actually poorer than it is with women. So it's very important for men, if they develop a lump on their chest anywhere near their nipples or anywhere on their chest, to have that checked out, just as it's important for women.
Okay. Carmen, maybe you can kind of help with this a little bit too. I think some of the statistics that Dr. Weinstein gave kind of may answer this question, but I know I've heard from people who've said, okay, I know there's a whole month for breast cancer awareness in October, but there are a lot of other cancers too. Is it because of the numbers and the statistics you just provided? Is that why that whole month is dedicated?
Well, I think the months of recognition, it's kind of some national observances that are set by, and I'm not sure who the bodies are, but it's this national observance calendar that we all kind of follow. And so October, for as long as I can remember, and I'm not sure who decided, but has always been Breast Cancer Awareness Month. And so we do try to really put a re-energized focus on our efforts in October, just because that's the month when everyone is thinking about it, and we can build on, what a lot of other people are doing, because it's easier to kind of get that awareness when you've got several other people doing it for the same reasons in that observed month. But actually what we do for breast cancer, as far as screening and diagnosis, and I can get to that later, is something we are willing to do all year long to help women with breast cancer. So it doesn't matter, of course, if it's in October or any time of the year. We've got our efforts in place to make sure we're helping women who might battle this disease all year long at any point in their lives.
And I think it probably just seems like it has gotten more momentum. I know there are other months that recognize other cancers, but October, like you said, it has been Breast Cancer Awareness Month for a long time. Mm-hmm. And it probably does have more momentum just because of the number of people who have been diagnosed with this disease and who have survived the disease.
I think when Dr. Weinstein's talking about the survival rates and how those are going up, or that the percentages are dropping of women who, die from the disease that's good news. And good news is easy to share and easy to remember, and something that's worth getting behind. And so I think a lot of people can feel like, let's keep that going, let's push that forward. And so I think that's huge.
So why have the death rates been going down?
The death rates primarily have been going down because of earlier diagnosis and because of I think better information to the women of the country. And I think that's one of the great reasons for having months like this, but as Carmen says, also year-round awareness. The earlier you diagnose breast cancer, far and away the better your statistics are. If it's an insight to a stage 0, we call it, it's about 100% cure rate. Even if it's stage 1, it's very close to 100% cure rate. Stage 2 is 93%. You get to stage 3, now you drop to 72%. You get to stage 4, you drop to 22%. And so it's very important to diagnose this early. So that means awareness. That means if you feel a lump in your breast, or if you have some sort of change in your nipple or change in the skin, that you have that looked at by a qualified physician or medical provider immediately. It also means screening mammography. Screening mammography studies have shown lead to somewhere between a 15 and 35% decrease in breast cancer mortality. And so one way to just think about that easily is, if you do your breast cancer screening the way you're supposed to do it, you have a 25% less chance of dying of breast cancer. And I know there's some controversy about exactly who should get screened and how often they should get screened, and when what age should you start and what age should you stop. And there's scientific reasons to argue some of those points, but I think there's really no reason at all to argue the fact that screening mammography works.
So what is recommended?
I think the best recommendation is the American Cancer Society recommendations, which is you start at 40, you quit around 70, 75.
Okay. So I know there's some testing. Is it BRAC? Is that?
Yeah, BRCA.
BRCA, okay.
Breast cancer is the breast cancer gene.
Okay.
And BRCA1 and BRCA2 were the first two genes that really got discovered and worked with. We now know there's lots of different genes involved in breast cancer genetics. BRCA1, I think became, I don't want to say became famous, but kind of became famous because Angelina Jolie Pitt has BRCA1, and that always catches everybody's attention when somebody famous has something. Mm-hmm. If you look at the people, about 1 in 800 or maybe 1 in 1,000 people will get one of those genes. But if you do have those genes, if you have a BRCA1 mutation, you've got somewhere between a 50 and 80% chance of developing breast cancer. So obviously it becomes a very important thing to know whether people and whether certain families have those mutations. Like I said, it started to become better understood that there's a lot of other genetics that go into breast cancer. And so we've started, pretty much every woman with breast cancer, we've started to look at the genetics of the tumor. There's different tests. There's something called an Oncotype DX. There's other ones that you look at maybe 21 or 23 different genes. And by looking at all those genes, you can figure out how to best treat somebody. You can individualize a treatment plan for a particular person.
Okay. So how is that test done?
Well, the BRCA test, if you're going to test, let's say for the sake of argument that we discover a person with breast cancer has a BRCA mutation. Well, now we're going to test all of their relatives. Those tests are done with a blood test. It's just you draw some blood and you send it to the lab and test it. This Oncotype DX test, where you're trying to look at multiple different genes in somebody who has breast cancer to figure out how to treat them, that's actually you take the tumor that you've removed and you test that tumor.
Okay. You guys are kind of nodding. These are terms that you've heard.
Yes.
There's, I would imagine, a whole new vocabulary that you develop when you're
That's right.
diagnosed.
Well,
Yeah.
Dee Dee has 5 daughters, and she went through we call it BRAC because it's just easier for us to say one word, BRAC. But she had the BRAC testing. I have not had that, but I do intend to get it.
Yes.
But I did have the Oncotype DX test, but based on our individual situations, so, yeah.
So let's talk about your stories. And Dee Dee, can we start with you?
Yes. Well, in the spring of 2013, I had my mammography, and there was some abnormality, and I had the BRAC test in 2009, and there was no mutation. So I thought I was home free. I dodged the bullet, and I said to Dr. Newman, I don't think I want to do anything, and he said, we're going to get that cut out. So he sent me to Dr. Weinstein, and sure enough, it came back, and I had 2 different types of cancer, and but it was caught early, and so I then, after the surgery, and I healed a little bit, then I went to our cancer center here, which was just marvelous because you don't have to travel anywhere. You're here in town. Wonderful doctors there. Dr. Marvel, we call him Dr. Marvelous, and he was really great. And I did not need chemotherapy, the radiation. So I had all those treatments. And they were so good and explained about skin care. They even gave samples so the skin didn't break down. I didn't have any, really burning or anything like that. And then I went to Dr. Harwood, who is hematology and oncology, and he put me on a Remedex, but I took it for 6 months and wasn't able to continue it. But he still sees me every 6 months and draws blood to make sure the markers are okay and there's nothing going on there. And he's so funny. I saw him just the 22nd of September, and I said, I'm going to be on the radio. What do you want me to say about you? And he said, well, tell them when I walked into the room, you thought it was Brad Pitt.
Oh boy.
But I really was concerned about my daughters because I had 2 nieces that had cancer in their 30s. And the oldest niece had to have total hysterectomy and bilateral mastectomy. And she's good. And then the second niece, her sister is a little younger, she just had a breast removed. And her BRAC test was no mutation, but the oldest girl was positive for that. So I was glad, really, that mine showed no mutation with the 5 daughters that I have. I don't worry so much now. I just want to say that I think we're so fortunate to have the cancer center here. Nobody had to take me anywhere, and they were kind. I know, and Dr. Weinstein let my whole family come in and talk to him, and as did the other doctors too. So we felt very comfortable. And I think that you need to follow the doctor's orders and get your mammograms every year and do what the doctors tell you. And prayer doesn't, it helps a lot. St. Jude is our patron saint, the saint of the impossible. And believe me, there were a lot of prayers said. So.
Very good.
Okay.
That's awesome.
Joyce, let's hear your story.
Okay, well, last summer of 2014, I was having my annual mammogram, and because of the way I am put together, I have what's called fibrocystic disease, only now they call it disorder because it's not a disease, you don't catch it, but it's lumpy breasts. And so at the age of 30, I had a baseline mammogram, and then had mammograms every other year until about 40, and then started the annual mammogram. So I've been, quote, stepping to the plate for a long time. And every year, everything was clear. And I come right here to Logansport Memorial for my mammograms. And this year, there was a suspicious spot, and so I went back for an expanded mammogram and an ultrasound. And Dr. David Martin came in, and he sat with me, and he's a friend of the family, goes to our church. And this is 6 weeks before our only daughter's wedding. And he says to me, you need a surgeon, and you need one now. And it was an extremely poignant moment, shocking, tears flowing down my face. I just couldn't quite get my head wrapped around it. But I collected myself, and I walked out of the radiology department and across the commons at the hospital and went into the office of Dr. Jim Hall. And at that time, I entered what I lovingly call the whirlwind. They pretty much take over your life to tell you what you need. Now, I was knee-deep into Mother of the Bride stuff, and cancer was not on the guest list.
It was
not there.
No.
I did not have time for this, but you take the time because your life is being altered. So I had an MRI. I had a lumpectomy and a sentinel node biopsy, but 3 weeks before the wedding, I was able to heal and wear my fancy dress, and I had energy, and I had a wonderful celebration with our family. And then the week after that, I sat down with Dr. Harwood, the oncologist, who graciously had delayed telling me my oncotype score so that I wouldn't have that pressing on my emotions during the wedding. But my score was high enough that I needed chemotherapy. And it took me back because I was only a stage 1. My lump was not palpable. There was no sign that there was anything going on except what came from the mammogram. So I asked why, and he said, why do I have to have chemo? And he said, well, your cancer type is aggressive. You're 57 years old, and this is an insurance policy. We had 2 grandchildren at the time and 1 on the way. And at that moment, it's a no-brainer. You do whatever you can to reduce your risks and lengthen your life. So I had 12 weeks of chemotherapy right here in Cass County. And I don't care what anybody says, it sucks. I'm sorry to use that word on the radio. It is not fun. But it is something you go through, and you deal with it. And much like Dee Dee said, the prayer warriors that I had around me lifted me up through some very dark days. So I got through that, and then in October, I had a second surgery to clean up the margins of the tumor, the original tumor area. And then I started daily radiation, also at the Logansport Cancer Center. Yes, he is marvelous. He really is. I had no burning. I had no pain. Just the only issue is you go in there every single day, but those folks become like family to you. They ask about what's going on in your life, and they're very attuned to whatever is happening. So from May to December, 8 months of my life I spent with doctors and labs and more needle sticks than I can count. But I'm here, and I'm a survivor, and I praise the Lord, and I praise family, and I praise the doctors and their wonderful, wonderful caring staff that took care of me, and so that I could stand here and tell you about this. So thanks.
Well, ladies, thank you for sharing your stories. That takes us right up to the time where I think we should probably take a break, and then we'll come back and we'll talk more with you after the break. Talking this morning with representatives from Logansport Memorial Hospital and breast cancer survivors Joyce Eshelman and Dee Dee Tangy.
WSAL America's best music.
Good morning. We are back with Talk of the Town. I'm Michelle Dials, talking this morning with representatives from Logansport Memorial Hospital. And I will go ahead and have you guys introduce yourselves again, and we'll start over here.
Oh, sure. Okay, Carmen Danhauser. I'm the marketing coordinator for the hospital.
And I'm Dr. Todd Weinstein. I'm one of the surgeons at the hospital.
All right. And on the first Thursday of October, traditionally, we have done a show like this where we've talked with breast cancer survivors. And this morning we're talking with Dee Dee Tangy and Joyce Eshelman. You guys shared your stories before we went to the break, and thank you for coming in this morning and talking with us. Carmen, do you want to talk a little bit about why you feature people?
Oh, sure. Well, Michelle, the stories that are the most inspiring are the ones that have the good outcomes and the positive messages. And so there's nothing that's more inspiring and hopeful than featuring survivors and how their individual lives and families were affected by a disease that affects everyone. Joyce, when we were at the break, you were talking about how many people, probably know or have been impacted in some way by breast cancer. And so I like to take each survivor and ask her about her story, and then also about how it affected her family, because as a woman, as a mother, a wife, a daughter, a sister, whatever you might be, you are a pillar in your family, and it not only affects you when you go through something like this, it affects everyone around you. And so it's just really important to share those stories, and when they're hopeful and positive, and they can encourage other women to take steps in getting screening mammograms done and taking advantage of all that we can do to catch breast cancer early, I think that's a win-win. That's huge. So it's beautiful and wonderful ladies like this that give us that story material, and I just love working with them.
Is there anything you ladies would like to add on that note? We talked about how it affected you, but family-wise or that sort of thing?
Dee Dee, you want to go first?
Well, I don't. My family, of course, was very concerned and went with me at first to the doctors and whatever. But I'm pretty resilient, and I was able to drive myself because it only takes a couple minutes to get the radiation. And in fact, when we went, the girl said to Dr. Marvel, well, we can take Mother. And he said, well, why can't she drive? And they said yes. And he said, well, she can drive herself. It's fine. And really, the only effects I had from the radiation was maybe just that I didn't have as much energy as I usually have, and but my family was there for me, and I don't know how much they suffered. I didn't suffer very much, so.
And I have two children. My husband and I have two children, and my husband Dave, have married 35 years. I often say he was my rock. Your family does what they can, but they're watching their mom go through some difficult stuff. And our daughter does not live around here, so she was able to start her new married life. We talked often on the phone. What really helped me was I started a blog. It was an email blog, and I was emailing approximately 50 people on a monthly basis all across the United States and around here, telling them what I was going through. And I got very specific about the treatments and what I was feeling and things that I was sharing. And about halfway through this, I had one of my friends say, my husband's reading this. And I thought, oh, great. Now I have to really edit this for the mail idea. Okay,
They
fine.
should have told you that up front, Joyce,
little
for
bit,
heaven's sake.
yeah.
But what was coming back to me then in the email's response, and I got so I loved it. I would sit down and write, and then the emails would start back in. They would tell me that they were seeing it from the up close and personal perspective, but it gave them specifics to pray for. If I was facing a treatment or a test, they knew what they could concentrate on. And Dr. Hall would say to me, you're healing so quickly. We wouldn't expect this necessarily. Well, I expected it. Mm-hmm. I knew what was going on. Mm-hmm. And I'm not going to say that it was a walk in the park. I wouldn't wish breast cancer on my worst enemy. But you deal with it, and people seem to rise to the occasion to help you in any way possible. I also was trying to figure out how to ask people so that I didn't wear out my welcome in their generosity. So it's a tightrope that you walk. You want to be strong, but you also want to let them nurture you so that you can rest. Fatigue is a big factor in fighting any major illness or disease. And along with Dee Dee, I want to reiterate how fortunate I felt that I was, and my family will concur, that I could have every single treatment right here in Cass County. Mammogram, chemo, radiation, everything. The people were top-notch. It was really, really great.
And Michelle, I want to just jump in on that because Joyce and Dee Dee are two of our biggest, reasons and supporters of that bring the reasons to life of why we did what we did. Back in May of this year, the hospital did take over the Logansport Regional Cancer Center. That was after they had received their treatments, of course, but. The hospital offers a lot of service lines, and as Dr. Weinstein said, there are a lot of physicians who work together to address breast cancer and treat it in different capacities, all right here in Logansport. But they have to coordinate a lot of care. Joyce and Dee Dee and every person, every woman going through breast cancer treatment meets with a lot of different doctors who all have to know at different points what's going on, what they're getting, what's happening to them. And so it's coordinating that care that is really important, but is also made easier by the partnerships and affiliations we have in place, and then the service lines that we do have here underneath our umbrella at the hospital. So bringing on the Logansport Regional Cancer Center, really the goal there, I know from hospital leadership, was to keep that much needed service in Cass County and to keep it here for those patients, because as Dee Dee said, if you only have to drive a few minutes, or if the treatment only takes a few minutes, but you have to drive to Indianapolis an hour and a half one way, to get that few minutes of treatment, that's a huge inconvenience, maybe on you, maybe on family. We can provide that top-notch care. I've often talked to Dr. James Hall. He says the care that we all collectively provide as the specialists at the hospital would rival that of the big cities, and he would know, and Dr. Weinstein, they would know. I mean, they're the ones providing the care, but I just think it was so important, and I love to hear them say how much that meant to them. Those are some of the reasons why we do the things that we do at the hospital, to branch out and take on those services.
Dr. Weinstein, let's talk a little bit about how treatment plans are developed for patients, because both of these ladies have different stories.
Yes, they do, and I think that's an interesting point and an important point. Is that you don't treat every person's breast cancer the same. There are a lot of different decisions to be made in the treatment of any person's breast cancer, and as Carmen says, the one great thing about here is the fact that we do have the entire team in place. We have radiologists, Dr. Martin, who was mentioned earlier, along with his partners, Dr. Vanderlyn and Dr. Babchuk. We've got Dr. Harwood along with his partners, Dr. Miller and Dr. Mulheron. And then we've got Dr. I was just Marvel. I was not aware it was Marvelous, but and it's a great team. And one of the great things is it's a great size team, and we can communicate and we can coordinate everything. And we do get together. We have a meeting once every month, and we sit down and we talk about every cancer patient, whether they be breast cancer or other cancers. But even in between those meetings, we're always talking back and forth and coordinating and trying to decide what the best treatment plan for an individual is. You've got to look at all sorts of different factors. There's different surgeries that can be done. There's a lumpectomy, which is just remove the cancer. Then there's a mastectomy, which is remove the entire breast. Some women need radiation and some don't. That decision is based on one set of factors, things like whether or not it was a lumpectomy or mastectomy, how many lymph nodes are involved with the disease, whether any of the margins of the surgery are involved with the disease. And then there's a whole different set of criteria that determine whether or not you get chemotherapy, and that has to do with things like whether the lymph nodes are involved, and again, what the genetics of the tumor are, things like that oncotype score that we were talking about earlier. And so it's two different sets of questions that determine whether you get radiation, whether you get chemo. Some people need neither, some people need both. But it's having that whole team in place and working together that allows us to make the best individual decisions for each individual person.
And what is the difference between radiation and chemo?
Chemotherapy is taking some sort of a medicine, either intravenously or pill, that gets into your system and works on the cancer. Radiation is an external beam of energy, it's X-ray energy, that's directed at the tissue around the cancer or at the cancer itself in an effort to kill the cancer.
Okay. Thank you for addressing that. I think
Sure.
that might be something that would come up for people. You have all alluded to the resources, and not alluded to, but you've all spoken about the resources that are available in Cass County. Can we kind of recap for people what all of those resources are?
Sure. There's at radiology, at the X-ray department, they have the Logansport Memorial Hospital Breast Center, and it's really a full-service breast center. They've got mammography, they've got digital mammography. We have the availability of ultrasound-guided biopsies. We have the availability of stereotactic biopsies. These are different kinds of minimally invasive biopsies that I think clearly are the best way in 2015 to do biopsies. All of that equipment, all of the personnel are in the X-ray department to do that stuff. We have, as I said earlier, 4 different surgeons who all work with breast cancer patients: Dr. Lala, Dr. Winkle, Dr. Hall, and myself. We have the 3 medical oncologists. Their main office is at St. Vincent down in Indianapolis, but they're up here 3 days a week. And that's Dr. Harwood and Dr. Miller and Dr. Mulheron. And then Dr. Marvel over at the Cancer Center, which is the radiation center. And as Carmen said earlier, just within the last year, that center has actually become officially part of Logansport Memorial Hospital. And she said something about the convenience of people not having to travel. I think it's more than that, really. There have been studies that show that women who have to travel too far for their radiation just don't get their radiation, and either have a worse survival rate or get pushed into having a mastectomy that they otherwise would not have needed. So it's more than just convenience. I mean, it's a very important thing, and I was very pleased to see the Board of Trustees of the hospital step up and support the Cancer Center so that could continue in this community.
Carmen, can you kind of talk about a program that I know we've talked about before, but for free screening?
Yes. Michelle, we receive a grant each year from the Indiana Breast Cancer Awareness Trust, and the monies for that grant, we're not the only recipient, there are recipients throughout the state, but the monies for that grant come from those license plates that you can buy with the breast cancer awareness. So that's how that starts. And the funds from that grant are used for free screening mammograms. So as Joyce talked about, she went in for her mammogram routinely to establish the baselines, clear, everything came back. Those are screening mammograms when you're just looking to make sure nothing's going on. When they found the lump, at that point it moves to diagnostic, where they have to take action and do something, and the type and the cost of the mammogram changes. And so, because there's more involved. So the grant gives us the monies to provide those screening mammograms for women who may not have insurance or who may not have enough insurance to cover those. They have to meet very specific criteria to receive that money. But then what we do to take it a step further through our hospital foundation with our upcoming River Bluff run, and we've had that for about we've had it for a while, but I think the last 4 or 5 years, it's really just focused on the breast cancer awareness ever since I kind of came to the hospital. And the monies raised from that event go to a specific fund in our foundation that helps women once they move from screening to diagnostic mammograms. Again, if they are uninsured or underinsured and can't cover that cost, we are able to step in and help them with that so that they get the care that they need in those specific instances. So that's where, like I said, our efforts, they're very re-energized in October because that's the month when it's top of mind for everyone, but that is available for patients and women, men if they would need it, but really, mostly the women who are the patients all year round. That can happen at any point.
So if people have questions about that or need that, who would they get a hold of?
Yes, you could call the foundation office. The number for that is 753-1595. All of that information is on our website at logansportmemorial.org. And then the person who kind of leads the foundation is my boss, Vicki Bird. So if you ever see her out in the community, or me, or anyone in our office, we can kind of talk about it with you. But it's definitely something that we're all committed to at the hospital and in the foundation to keep that going.
And River Bluff Run is coming up.
Yes, in just a couple of weeks. It's Saturday, October 10th. These ladies are going to be there, so we're so excited to have them. It'll start, probably the run starts at about 9 o'clock. The walk starts shortly thereafter, so you can do either portion. It's $20 to register before race day. It's $30 the day of. We'll be down at the River Bluff Trailhead that's kind of down on Michigan Avenue, close to the hospital. And I think I covered most of that. We do have a nice website with a lot of information you can register online. So it's linked to our current website. That's logansportmemorial.org/cancer-run. And if you go there, you can, like I said, sign up online and read their stories, you don't want to miss those, and a whole lot of other nice things. So we've had a great experience this year.
All right, Joyce and Dee Dee, what advice would you give to other people that have been recently diagnosed with breast cancer or any type of cancer?
I think it's very important to get your annual mammogram and do your self-breast exam, and watch for any discharge or dimpling of the breast, and get your annual checkup from your doctor. I just want to say something about Rich Voorhees. He took wonderful pictures of all of us, and we're so lucky to have him in our community.
Absolutely. Absolutely.
Well, I agree with everything that Dee Dee said. I would also recommend, if you're faced with this for the first time, get a notebook and carry it with you, a small enough notebook that you can put in your purse, because there's a lot of information and it's hard for you to sift through it. Doctors have a tendency to talk in acronyms. I have a real quick funny story. Do we have time for a funny story? Okay.
Absolutely.
Okay, great. So I'm laying on the table after the expanded mammogram that Carmen talked about and the breast ultrasound, and I'm there with this ultrasound technician. She's very sweet and very kind, and I'm laying there on the exam table, and Dr. Martin comes in, and he's talking to her about some things because she's not finding anything on the ultrasound, and I'm thinking, oh, yes, I'm clear on this. So then he's telling me, I think you need a scare tactic. A scare tactic. Okay, I'm laying there going, I really don't know what a scare tactic is, but I'm scared enough as it is. So I listen to them talk, and I finally turn to her, the little technician, the young lady, and I say, you're going to laugh at this, but I think he's saying scare tactic. And then they both break out laughing, going, no, it's stare, as in S-T-A-R. It's a stereotactic biopsy. It's something that the surgeon and the radiologist guy do together. And once we started laughing, then it was kind of, the tension was broken. And okay, now we can actually go forward and talk about what your protocol is going to be, what your treatments are going to be. So I needed that little notebook. I went home and tried to get my head wrapped around all this and got the notebook and started the timeline and the things, because yes, you are constantly being scheduled in various things. So get a notebook. And then another website that I used a lot was breastcancer.org. It's actual forums of women with personal stories about different things that I could read about. It helped a lot. And then finally, another book that a friend sent me. It's called Uplift by Barbara Delinsky. It is nothing but stories of survivors. And in the beginning, when you're so frightened, all you want to hear is the positives. And I carried this with me to read when I was waiting on my various treatments. So those are my 3 tips.
And we had kind of talked during the break, Joyce. You said the stories are what helps, the stories of people who have overcome.
Oh, absolutely. When you're going through chemo, you lose your hair. It's just part of it. And so, yeah, I learned how to wear the wigs and wear the scarves and all that stuff. But pretty much everybody knows. They look at you. And some people know what to say and others don't. So I'm standing in line waiting at a buffet or something, and this elderly lady, way older than you, Dee Dee, way older.
There's nobody older than I.
Oh, boy.
Anyway, she comes up to me and she puts her hand on my shoulder and said, I'm a survivor. And there's a sisterhood. There really is. And you just hug and you thank them, and then if they want to share their story, that's fine. But your life has changed. Cancer is a part of my life now. Now, I don't dwell on it, and it doesn't control me, but I have to acknowledge that it is a presence in my life. And I go forward, and I do what the doctors say. I agree with Dee Dee, do what the doctors say, and I praise God for the healing and for the medical community that we have. I totally agree. When you've gone through a treatment, first of all, you're very, very nervous prior to the treatment, and then the letdown. When you can just go right home, 10, 15 minutes and you're home, then the extra healing begins. So we're very, very fortunate to have all this right here.
Ladies, thank you for sharing your stories. I know that we do have survivors listening, so I appreciate you coming in and sharing those stories with us. Dr. Weinstein, as we wrap up, what is your advice to the women of our community?
Well, I guess my first advice would be listen to Dee Dee and Joyce, because they nailed it. I mean, I think what they both said is absolutely correct. The only thing I would add to that is, and again, clearly, cancer of any sort, and breast cancer, is never anybody's fault, never anybody's responsibility. But at the same time, there are certain things you can do to decrease your chances of getting cancer or getting a bad cancer. Do what Dee Dee said. If you have any lumps, any bumps, get them checked. Go to your doctor and get checked once a year. Get your mammograms when you're supposed to get them. Do your self-exams. All that is absolutely true. There are some risk factors that can be modified. If you maintain a healthy weight and if you exercise on a regular basis, there's a perhaps 1/3 decrease in your chances of having breast cancer. Use hormone replacement therapy for as short a period of time as you can when you go through menopause. Limit alcoholic drinks to 1 a day. So there are things you can do to protect yourself, but I think what Dee Dee and Joyce said really sums it up better than anything I could possibly say.
You said that you've been here almost 25 years, right?
Getting close.
So how has this topic changed during your career?
Well, I think the availability of different types of treatment has really expanded. All of the genetics is new from the quarter century that I've been doing this. None of that occurred, when we were starting. So I think all of that allows us to treat individual women much more individually. The different biopsy techniques are much less invasive. The surgeries are less invasive. We used to take out 25 or 30 lymph nodes, which would lead to arm trouble. We now take out maybe 2 or 3 lymph nodes. The advances in treating breast cancer over the last quarter century have really just been tremendous.
And 25 years ago, I mean, that was the early 90s,
Correct.
right?
91. I came here in 91.
So, I mean, that's not like we're talking about how has it changed since 1950. I mean, things are evolving every day.
Things are evolving very quickly. It's the pace of progress in breast cancer is just tremendous. And I think that's important to keep in mind because sometimes I've had women and they say, well, gosh, my aunt had breast cancer 30 years ago and it was horrible, and so I don't want to do this and I don't want to do that. I say, what happened 30 years ago has nothing to do with what's going to happen to you in 2015.
That's right.
All right. Anything else from anybody else before we wrap up this morning that you'd like to share?
Well, I want to thank Talk of the Town for letting us sit here and talk. We appreciate the ability to tell our story. Thank you.
Well, thank you, ladies, for coming in, and we'll do this again next year.
We're already looking forward to it, Michelle.
All right. Thank you so
Thank
much.
you.
Carmen Danhauser, Dee Dee Tangy, Joyce Eshelman, and Dr. Todd Weinstein. Thank you, guys.
Thank you.
Thank you.
That'll do it for us for Talk of the Town for today. We'll be back tomorrow with more.